With the changing season as we enter fall and winter, most people feel that it takes a toll on their mental health. Seasonal affective disorder is characterized by lower mood, lower energy, and perhaps an increase in appetite or weight gain that has a correlation with the seasonal change. For the budding doctors out there, a way to remember the constellation of atypical depression symptoms is to think that these symptoms are associated with the winter blues: low energy, malaise despite increases in sleep, increases appetite. MAOI inhibitors are the classic treatment. Think of an uncommon treatment for a common problem. And if you have these symptoms, you're more likely to actually respond to bright light therapy. The easiest way to treat seasonal affective disorder is with light therapy. Bright light therapy consists of a light box or device with a fluorescent bulb that emits a white light. And it would sit on a table or desk and emit that light into your eyes for about 30 minutes each morning. It doesn't need to get onto your skin. Light therapy helps to make up for that deficit in light exposure that individuals experience in the winter months. Low vitamin D, on the other hand, is caused by low amounts of sun reaching the skin surface. But the light needed for seasonal affective disorder is into the eyes and the retina to help trigger the suprachiasmatic nucleus. The SCN is implicated in sleep-wake cycles and indirectly affects mood, cortisol levels, and has other downstream effects on serotonin, dopamine, thereby affecting one's mood. Well, who can benefit from bright light therapy? Individuals who have major depressive disorder or bipolar disorder, wherein it presents in a seasonal pattern, or in fact, some research studies show that it can help with non-seasonal depression. It can also help for people who are on antidepressants but not responding as well as they'd like. It has been shown to serve as an adjunct and also speed up the response to antidepressant treatment. Also, pregnant women who don't want to take a medication. So how to use a light box? The device should be at least 10,000 lux, which is a measure of brightness. 10,000 lux is the equivalent of being outside on a sunny day, whereas a cloudy day would be about 2,500 lux. The device should be positioned at a distance of 16 to 30 inches or so a little less than an arm's distance length away. The distance is important because light dissipates proportional to the inverse square, so if the distance is doubled, the light drops to 1/4 of the intensity. Devices that are less than 10,000 lux or further than 30 inches away would require a longer session of exposure. The light box should be used soon after awakening, sometimes between 6 and 8 a.m., and at the same time each day. If one is using a 10,000 lux box, aim for 30 minutes, and with a lower intensity such as 2,500, aim for about 2 hours. In general, patients can glance at the light, but they should aim to keep the light somewhere in the peripheral vision while reading, eating, watching TV, and working on a computer. Patients who start bright light therapy should respond in 1 to 4 weeks of starting treatment. Light therapy should be continued for at least 2 weeks beyond when the depression has ended. In one study, patient improvement continued after stopping the light box, in fact, but should you experience a recurrence of depression, light therapy should be restarted. What are the side effects of bright light therapy? Light therapy is generally well tolerated and safe, but if you have a history of depression or bipolar, I'd suggest checking in with your psychiatrist first. Side effects are mild and improve with time. While there are no absolute contraindications, individuals with eye conditions such as cataracts, which could potentially decrease the effectiveness of the light therapy, should consult an ophthalmologist. The most frequent side effect is eye strain and headache, but other side effects could include nausea, anxiety, insomnia if administered too late in the day, or agitation or irritability. Also, be careful that it could potentially induce hypomanic symptoms if you have a history of bipolar disorder. The side effects can be managed by reducing the amount of exposure to the light, but also talk to your doctor about it too.